is like your baseline, what you'll be compared to in 6 months. So this is basically the list of duties that you'll be doing and what you're supposed to be doing. And then 6 months from now is when you'll be your true EPA 2 is your true evaluation of how you've completed what your EPA 1 is. Any other questions?
But you'll let us know about the insurance before the open enrollment comes up, so
Yes.
everybody can decide.
Yes. Prior to, we didn't feel it was fair to change it during where you couldn't change your coverage. So we're going to wait to open enrollment, which is April, right, of every year. So 6 months before April rolls around, we'll tell you we'll be cutting it either to 80-20 or 70-30, whichever. We're going to see what the state's doing and go with what they're doing, and then we'll let you know ahead of time. And then retirement, you need to know if anybody's interested.
Oh, yeah. There's Tina and Julie and I had went to a retirement workshop, and they had discussed ING. It's you can take some of it out of your paycheck and put towards a retirement. And so if anybody's interested in that, you'll be investing in securities and stuff like that. It's mandatory with the new state workers. They don't even ask them, they take out $10 per pay period, and then they have to opt out. That's right, excuse me, that's right now. And so if anybody is interested here in investing, and just, let me know, and I can have somebody to come and talk with you about it.
If we go to 80-20, it would double. It would double, yeah. See, right now, technically what we do is we pay 50% of the employee's part. So whatever you're paying a month, you would double that. And that's what 80-20 would be.
Right.
It's like if, I think a single person, we'll use Carrie as an example, single nothing else is 46.
I paid like, $25.
It's like $46 or something a month. So hers would double, so it would be almost like $100. Yeah. So whatever we go, that's 80-20, which probably depends on what the state does. Because when we talk to the state guys,
we're paying 80-20 right now.
No, we're
I'm
paying
sorry,
90-10.
gotcha. Okay, I'm with you.
70-30 would be a little bit more, but we don't. It depends on what the state does. Because I'm going to try to get to whatever the state does.
And is that just because the board wants to cut costs on that?
Yeah, that'd save about $12,000 a year, just from going to 80-20, which is what the majority, almost all, but the state does. And like I said, they even talked about cutting costs, going to 70-30. They would have to go through legislation though to do that.
State would.
Is the percentages, whatever you decide, is the percentage of whichever plan the employee would select?
Yeah, it doesn't matter. Like if
I have like the bare bones.
she has the bare bones plan, it's still 80-20. That's the way the state. We're going to do whatever the state does it. That's what we're going to do. So it's 80-20. Like you pay more for family and more for certain things. If you're a smoker, you pay more. But that's just 80-20 is built in to the system already. And so that's, and like I said, unless the state changes to 70-30, or unless crunch time happens with the board, and then we may go to 70-30. But right now it's looking like 80-20, definitely. But I just threw 70-30 out there because if that does happen, I don't want you to be completely shocked, because it may. Our next board meeting will probably be June. A lot of board members are out of town these next couple weeks, so it'll be in June.
I have a clinical note.
Okay.
If anyone here, even if you don't work in the clinical area, if for some reason you would get a needle stick, okay, or a stick with a sharp object that might have blood on it, okay, that's a blood exposure, or could be a blood exposure. The arrangement that we now have is with Hayes Valley Hospital. You would immediately notify a supervisor. that had happened to you, and then you would go to Tays Valley Hospital, and they would treat you according to their blood exposure needle stick protocol. And then the health department would take care of the bill. Okay, so we have an agreement with the hospital now. There's like a 4-hour window period that you need to receive treatment after you would get a blood exposure. So just keep that in mind, just to keep everybody safe, even.
And that may happen like with the H1N1 clinics, how many of us picked up
Yeah.
those red boxes, you know, and packed in the car and moving back and forth? I mean,
That's right.
anybody can get a needle stick anytime we go to a flu clinic, so keep that in mind. And also, we're gonna have a couple of college kids working, probably the first week in June, cleaning out our storage units. We're gonna try to combine 2 of them into one, so we'll probably be getting rid of a lot of stuff. Can you, home health, how long do we have to keep home health, right?
I can take Shredded over there, like I can contact Shredded and meet him over there, and yes, I need to empty out every one of those file cabinets.
We don't
They're
need
full.
them,
No,
do we?
after 10 years, after a business closes like that is what the state told me I could, and they're like from 98
Yeah, they're old.
and
Okay.
older.
All right, that'll probably happen probably the first week in June, somewhere around in there, so you wanna call them, I don't know what day yet.
I might try to do that first, that way that stuff's out of there. Because, you know, some of those file cabinets are really in excellent condition.
Let me, I'll go over with you.
Okay.
We'll look.
Okay.
Something else too, this week Gary, I forgot about this until Gary and Blake have contacted me. This week and next week, they're gonna have workers in here in the evening, so we have to be out. Everybody has to be out by 5 o'clock. And you're not allowed back in the building. And environmental's 4. Everyone has to be out by 4 environmental, and then if you have to stay later, contact me, because I'm the only one Gary is gonna allow in and out. I don't know what they're doing, working on the sprinkler, I don't know, somebody's working on sprinklers or something. So, you have to be out of here by 5, I think they're gonna start working at 5:30. Any other questions? Get your vacation, I think vacations have been scheduled, most of them have been scheduled in advance. If you're taking off in the summertime, you need to get with your supervisor, because I know we have weeks coming up, and we have to make sure that everyone gets a chance to take vacation when they want to, so. Then we need to work out with Melanie. Becky's gonna be gone for 2 weeks, so I'll just leave you out there in June when she's gone. When do you leave? Are you?
End of this month. Week.
Who else has summer vacation? Dawn, you?
I'll be off next week because Bill's having surgery.
I knew someone else was having.
He's off too.
Thursday. Okay. All right, that's it. Did I get everyone's paper? Roseanne? All right, guys, that's it.
Alright. I was kind of hard to write mine because Sophie wanted to rip it different. But yes, I am. 17 months. But she's had her, I'm taking her doctor, I guess, for immunizations and all that, so.
How do? Am I allowed? Sure. Yeah, let's take back this way. I didn't know how to do it. thinking, what are you talking about? You're welcome.